right, good morning. So right now we're going to go through what's in the box of the digital implant restorative kit. This has multiple components, but let's just go through the box and see what's in there first. So you're going to have a box per suite. This is suite A, and you're going to have each piece is going to be numbered 1 through basically 10, right? So we're going to go through each box so you know what's in here, and then we'll do another video showing how to put everything together. So number 1 we have is a digital lab analog. So a digital lab analog is essentially, after you take your scans, the lab will fabricate a model, or you can as well in your office, and you would need what these are called digital lab analogs. So in terms of, we'll go to number 8 here. This is going to be placed in this position. So after you print it, then you have a replica to work. Sometimes you got to tap it to get in there, of where that implant is in space. So that is the digital lab analog. Do you always need this? No, but sometimes if you're doing cases that require a certain shape and you want to 3D print the model, then you'll need that to work off the die model. And there's ways to actually trim that tissue around there to make it fit better, but that's what that is. So let's take that out, just tap it, it'll come out. So number 1 is a digital lab analog. So let's put these back in the kits. And number 2 is going to be your 048 driver. This is for Dio. This is the right there. That is the model number, and that is the 048 hex driver. So that's number 2. Number 3 is going to be a basically healing abutment. Now this, we'll have another video on how to select healing abutments, but this is just a standard healing abutment for that we got. So this wasn't really picked for the case. This is just what we got. So we'll post another video on how to select the proper healing abutment. So that's 1, 2, 3. And number 4 is going to be, this is your, in Dio's world, we call this a scan adapter. You may see this called scan body. Essentially, this is what you use to transfer the information to the lab. So if we're going to basically send a scan for implant fabrication to the lab, we're going to use something like this that has the little square shape to it on the front to give it angulation. But again, some people call this scan body, but Dio calls it scanned adapter. So, okay. That's going to be if you're going to be sending it off to a lab. You could use these to do in-house as well. So they are multi-use, but if you're going to be sending to the lab, you'll always use that one. These are just a set of screws. So these are abutment screws. So we're going to use those. Again, put everything back in their little components so we don't lose them. And then number 6 here is going to be a scan post and a scan body. So you use scan post and scan body when you're digitally restoring chairside with CEREC. And the post tells exactly where the implant is in space, and that same with that little scan body. So these two pieces go together. So that's number 6. So that's gonna, if you're gonna restore chairside. And then also in number 7, this is a tie base. Tie base is what you cement your chairside restoration to design on CEREC on top of the implant. So that's number 7. And then number 8 you already saw was a printed 3D model of the case where the implant is going to go. Again, if you're doing things digitally with 6 and 7, you don't always need this, but sometimes it's nice to print these out and shape the crown a little bit better, or in the office without the patient sitting there. This is number 9 is your opposing. And then 10 is a Dio 2-piece ratchet. So you can see the ratchet numbers there, 15, 35, 50. It's 2 pieces, so sometimes this is out in 2 pieces like this, and you're going to have to put them together. And this has its own video because there's some nuances between a 2-piece and a 3-piece, and see how that little ratchet piece is not in there? That makes, you have to make sure that that's in the right position so it actually creates a ratcheting effect. So this is what's in your box for the digital lab analog, or digital implant restorative kit.